Hi everyone, welcome back to Four Strong and Growing. Today we are talking about vaginal tearing. I know, super fun topic for today. I'm going to give you 3 tips on how not to tear during your vaginal delivery. Okay, disclaimers. I am not a doctor, a nurse, a midwife, a doula, or any of those things, but I have been a mom for 8 years and I just had my last baby 1 month ago, so vaginal delivery is very fresh in my brain right now. Some things that can make you more prone to tearing are completely out of your control, like if this is your first delivery, if you are of Asian ethnicity, if you have a large baby, meaning that they are more than 8 pounds, if baby is face up, or if you have a prolonged second stage of labor, which is the pushing stage. All of these things can make you more prone to tearing, yet you can't really do anything about them. However, these 3 tips that I'm going to give you are things that are in your control, and while these tips may not stop you from tearing, they could very well help you stop from having a severe tear. All of my references will be linked in the description. I'm referencing RCOG, ACOG, Cleveland Clinic, and the Mayo Clinic in this video. Let's get into what is a vaginal tear. In case you don't know, this is like one of those things that you might not know can happen during labor until you get pregnant and you start looking into these sort of things. I definitely didn't know that this could happen until I got pregnant, and it's really not that fun to find out. A vaginal tear in medical terms is called a perineal laceration. The perineum is the area between your vagina and your butthole. Very fun, guys. I told you this video is going to be really fun. So when the baby comes out, you're being stretched to your capacity, we shall say. In the case of a perineal laceration, either the baby's head is too big for your vaginal opening, or your vagina just isn't stretching very easily. Either way, this can cause a tear in the skin, muscle, and the surrounding structures around your perineum. There are 4 degrees of tears. First degree is the least severe, and 4th degree is the most severe. A first degree tear is the least severe, like I said before, and it usually just involves the skin around the vagina, inside the vagina, on the labia, and it usually heals very quickly with no treatment. These tears sometimes are called lacerations or superficial abrasions, and they're not very likely to cause any long-term problems. A second degree tear is the most common type of tear, and it affects the skin as well as the muscle in the perineum. Second degree tears usually require stitches. I had a second degree tear with my first baby. I had my daughter without an epidural, and then the nurse said that she had to put a stitch down there, and I was like, what are you talking about? You're gonna stitch me up right now? No, thank you. And she said, would you rather have a little bit of pain right now or pain every time you pee for the next 3 months? And I said, put a stitch in it. 3rd and 4th degree tears are more serious. They are known as obstetric anal sphincter injuries, OAIS. No, OASI. And they can extend into the muscle that controls the anus. So as you can probably imagine, that could be a problem. So not only do these tears involve the skin and the muscle of the perineum, but they can damage the anal sphincter that helps you control when you're having a bowel movement. A 4th degree tear is the least common type of tear, thank goodness, because it extends into your anal sphincter. So if you've heard, when you have a baby, you can rip from your vagina through your butt. Unfortunately, that is true. It's not a myth. To treat this type of tear, your doctor will most likely need to take you into the OR to give you stitches. Now that we know all the different degrees of perineal lacerations, let's talk about my 3 tips of how not to tear, things that are actually in your control. My first tip is to avoid medical intervention, meaning epidurals, forceps, vacuum extractors, things of that sort. According to RCOG, tears are more likely to happen if you're using forceps and vacuum extractors to help pull the baby out of the vaginal canal. My second tip is to use controlled pushing. Now this kind of goes along with not getting an epidural. This is sort of a hypothesis of mine that it would be harder to do controlled pushes when you have an epidural, specifically the type of epidural that makes you pretty much completely numb from the waist down. I'm not talking about walking epidurals or an epidural that didn't work completely. I noticed during my deliveries when I haven't had an epidural that my body kind of gives me cues on when I should be pushing, how hard I should be pushing, what area to really focus on. When you're numb, you're not getting those messages from your body. So it's probably pretty easy to just mindlessly push as hard as you can just to get the baby out, because that's what you're supposed to do, push and get the baby out. But pushing as hard as you can, I don't think is the best thing to do. I think controlled pushes are more of the direction that you want to go to stop yourself from tearing. If you haven't heard of the Ring of Fire, the Ring of Fire is basically when the baby's head is crowning and you're being stretched open as wide as you're going to be stretched open during the delivery. And as the head is sitting there, sometimes your contraction will end and the head will sit there until you get your next contraction to push the baby's head out. As you can imagine, it can be really painful when that happens, and you may be thinking to yourself, why in the world is the universe doing this to me? This hurts so much. That was such bad luck. I just want to push this baby out. But actually, it's a really good thing because it gives your skin the ability to have time to stretch out, and that actually stops you from tearing. When it's time for your next contraction and to push the baby out, you are much less likely to tear. So it's actually a good thing, even though it hurts really bad. My third tip is to birth in an upright position. There is a lot of information going around, especially recently, I feel like, about delivery positions. A lot of people are pushing back against delivering flat on your back, like we have all been told to do for so many years, and we're finding out the benefits of different types of birthing positions. I'm not going to go into detail about that whole thing because it's kind of a rabbit hole, but I will link my reference down in the description. My reference for this one is the Mayo Clinic, and they say that birthing in an upright position can reduce your risk of tearing. All right, now I have a little bonus tip for you, and I wanted to include it because a lot of people say that it's really helpful, but I was a little hesitant to include it into my video because I've never done it before, but I feel like I need to mention it. So my bonus tip is perineal massage. Now, apparently this can be really helpful if you start implementing this around the end of your pregnancy, like 34 or 35 weeks up to delivery. And a perineal massage is basically, as you can imagine, massaging your perineum. So it helps if you start with a warm bath or a warm washcloth on that area to help relax your muscles and loosen everything up for the massage. The massage will really only work if you are relaxed. So it's really important not to skip that step. I'm going to put up a picture here showing how your hands should be positioned during a perineal massage. And basically you just hold this for about a minute. And then after you have stretched out that area, you can do a gentle massage in a U-shaped motion and do that for about 2 to 3 minutes. And that's basically it. So again, I've never tried it, but people swear by it, so I felt like I needed to include it into this video because it is something that is in your control that can help prevent you from tearing. All right, guys, that brings us to the end of this video. Thank you so much for watching, and if you liked it, please give it a thumbs up. And good luck to everyone out there who is about to deliver, because I'm sure that's most of the people who are watching this. My fingers are crossed that you don't tear. So good luck, also congratulations, and I will see you in the next one. Bye.